want another pillow? I got plenty.
Yeah, please.
So we use a 32 gauge needle, which is the size of a hair shaft. We have a lot of secret sauces for
Thanks.
minimal to no discomfort, and 32 gauge needle is certainly one of those. Pinch, pinch, pinch. And we also, the sting and the lidocaine is not the medicine itself, but the acidic environment that it's kept in. So we always buffer our lidocaine to take the sting away. And then I usually ask people if they want me to narrate. Some people are okay, other people it scares them. So. But that does not seem to be even.
No, we like the narration.
It's into it. So.
This map is from elsewhere, so I'm not sure about the SSB. I'll let you determine.
I might feel a little something here, but if it hurts, let me know. So this might feel like a butterfly floating up the leg. I used to say a spider going up the leg, but that didn't go up.
No, that probably
didn't go over real well.
butterfly's better.
Now it's a
Butterfly's
butterfly.
better.
Butterfly's better. Spider,
So,
you're not going to get the reaction here.
I gave you my Yogi Bearism. By the time we get started, we're halfway done, and remember, we got a lot of time to think around here doing these. But you know, Muhammad Ali, float like a butterfly, sting like a bee. Well, we sting like a bee, then we float like a butterfly inside the bee.
I haven't felt anything so far.
Beautiful.
All right, let the record reflect.
Stop your pain list.
Hasn't felt anything
Stop
so
your
far.
Let the record
We had a patient watch one of these videos by a surgeon, and just scared the bejesus out of her. They were putting nitroglycerin on her leg, all this stuff.
Oh my
and
gosh.
They couldn't find the vein, and just was scared out of her wits. But then was fine.
Yeah.
So,
I said, I
anyway.
can't believe you came to your appointment.
Yeah, exactly. I was
You
like,
wouldn't
for
have
God's
come.
sakes, why are you here? And anyway, she did fine.
Thought there was going to be a bloodbath.
So, anyway. And then I could make an incision, but I don't prefer to because, so it's going to be a little more pressure because I'm not going to make an incision because in a week it's going to be like Service Pro, like it never even happened.
Nice.
So,
That's funny.
So anyway, yeah, I watch. I have 4 kids, so I watch too much TV.
You have 4 kids?
Yeah.
How old are they?
17, 15-year-old girls and identical twin 12-year-old boys.
Wow.
Yeah, surprise third child. Twins
Wow.
happen.
Twins
They're
happen.
awesome. They're actually really like 1.5 kids when you have identical twins.
Yeah.
They get along so well and stuff.
Wow.
It's really pretty amazing.
Doing okay?
Oh, yeah. I'm loving that I can see the screen.
Yeah.
Anyway, so we got our sheath in, which is just a piece of hollow spaghetti, and that's all ready to go there. And this is the laser. Looks like 80-pound test if you're a fisherman or a fisher lady.
Thank you.
You ladies think what an 80-pound test is.
We just might. Just because we go glamping doesn't mean we don't
But
know.
there you go.
We could know that.
Glamping.
Yeah,
I didn't know what that is.
Well,
Glam or
clearly you
camping?
don't take Karen camping then, because
Oh,
she would do
camping.
nothing other than
Glamping?
glamping. I have
Actually, I do
no doubt.
have a story about that. The first time we did that, it was a KOA where they had, this was in the Smokies. They had, I think they were from Thailand, exchange students doing like 1 hour massages for $20.
Oh wow.
And so there's my wife
Could use that on my camping.
in the Smoky Mountains at, roughing it at a KOA, getting like this Thai massage for like $20 an hour. That's
That's perfect. That's what that is.
So anyway, there's an epigastric there, and we're just, double, triple, quadruple checking, and I'll check it again, but that's the tip of the laser. So we're at least halfway done here. This is detumescent, anesthesia, and you shouldn't feel much anything. If you do, let me know, because I can adjust what I'm doing. Veins pretty superficial here, and all our nerves are right under the dermis there, so I'm going to ultimately press this vein down a little bit here. See my needle there, and we're going to press it down. And so, we could theoretically laser all from the ankle all the way up, but that's pretty uncommon because most folks don't want the saphenous nerve is very close to the vein from about here down, so most people don't want to leave people with numbness. On the other hand, most people, when they have a vein leak all the way to the ankle, in most places leave them with that leak, and it results in recurrences and incomplete medical treatment. And you're probably saying, well, what do you do? Well, we use foam sclerotherapy, and so we're not going to leave him or any patient with any identified leaks. So foam is our secret sauce. You cannot be fully treated without foam. It's virtually impossible, and over half of Americans are undertreated because they don't get foam. Period, check, end of story. And so we have very good medical and cosmetic outcomes. How you doing up there? You okay?
Me?
Yeah.
Shoot, I can take a nap.
All right.
I told you.
Pinch, pinch, pinch.
I was expected to feel something.
Nah.
I'm not feeling anything.
Nah. Well, maybe we will change my name to Dr. Painless. We have refined a process. As interventional radiologists, we weren't working on awake patients our whole career, and so you gotta be good with anesthesia.
See that fascial plane separating?
Yeah.
Yeah, I do.
Here it is.
Mhm.
Isn't that
It's
cool?
cool. It is very cool.
And this is where I expected to feel something.
Right.
And I still
You brought your compression hose with you?
This is your tender area too.
Yeah, inside the knee.
I'll probably do the most tender area. It's another thing which honestly is more challenging is I'm going to make a lot less sticks on you than the average practitioner because I'm going to extend this needle the length, good 6-9 centimeters, actually it's about 9 centimeters. So,
Isn't that like a chiba needle?
It is it's like a 22 gauge Chiba, but I'm going to go the whole length, and to do that honestly takes more skill with this ultrasound, but that's what we got.
That's a good ultrasound.
You know, I think a lot of the best practitioners use this brand, honestly. I've been very happy. We have 4 of them. Shout out to Saote Ultrasound. Yeah, you're going to see this in most of the best ones, I think. So anyway, we're making some progress. So we're probably about 75% more done here. Pinch.
You know, of all the times I've seen this done, I was always so curious about what it would feel like. And I thought.
A little more?
I thought, well, you know, I'll feel this, I'll feel that. I got nothing. What the hell?
Well, now wait a minute. It is user dependent, honestly. There's patients come in here who've had this done that will give you horror stories, and I don't know why, but again, we are eucalyptus eating koala bears here. This is all we do now. So you want it professionally done, you go to people who do it all day, every day.
Oh, that's my point.
We are like bamboo shoot eating panda bears. That's all we do. So I make analogies for people all the time. I say you want your lightning team to be playing basketball half the day, baseball another part of the day, and hockey part-time. I mean, there's no substitute for experience with anything. Anything here is no different, so do enough to get real good at it. Anyway, a lot of people do a longitudinal like this, but there's no right or wrong way. But for us, this tends to go a lot better. And then when we hear people say that they had pain during the laser itself, it means they didn't get enough anesthesia, wasn't put in the right place, and that just doesn't happen around here either. So we've never had anybody hit us, cuss, or leave, or not go to a second leg, ever. So, I'm pretty proud of that. Probably not 85% down here. Pinch. Oh, a couple more tiny pinches here.
Did you guys have a good Memorial Day weekend?
Yeah, we were in Boston.
Oh, nice.
What's going on there besides good music?
Oh, we don't see a band actually.
Oh,
Just to hang out
nice.
for the weekend. We do a lot of long weekends.
Nice. What band did you guys see?
Not a surf.
What is it?
Not a surf.
see, we're really close to that
Mhm.
vein.
I really can't believe that I can't feel it.
You really can't believe that he can't feel anything. Some people have called us to complain that they can't feel anything after the procedure. And did we do anything?
I said my discharge sheet
High five.
says I might have some discomfort. How long should I
Yeah,
be concerned
exactly.
about this?
Now that's a
Wow.
worry wart right there.
Yeah.
It's
But-
like, I'm not feeling anything. I'm a little worried.
So that view right there, Nancy's cross section going down along the vein and around it, the
Yeah.
dark area around it, is that 2 mesh anesthesia filled up around it as
Yeah, that's cool.
Pinch, pinch. Should be it. Actually, what's gonna hurt you the most is
taken off this
you
straight.
got it. That drape is gonna pull your leg hair. It's gonna be the worst part. We'll let your wife do it.
Yeah.
That way you can say we never hurt you.
Well, she's never heard me either, so
Ah.
perfect record.
Yeah.
It's on you, buddy.
Both. It's on you. Have you worn the compression hose?
Mm-hmm. I did. As soon as I got them, I put one on just to try.
Sure. Okay.
So yeah, that's gonna be it for the washer. Anyway, we can fire that up over there. And I'm gonna cry if they don't put glasses on people. Anyway, that's the junction. The laser's good. So we're zone 6 to the junction. This looks real good. I'm gonna give it a once over. Usually do a little boost here. Especially since this vein's very superficial there, we're gonna push it down. Okay, that'll do it. So you shouldn't feel anything at all at this point. If you do, let us know.
Mm-hmm.
Pain or heat. Our length is going to be 40.
Yes.
And so although it's not requisite, we usually watch the laser as we pull it back. I think it gives us an advantage to what we do. I like to say it's not one thing that makes us world class. It's a number of small things all added
Sorry.
together. And I would say this is one of them. Just watching. And so the snow is obviously the steam bubbles coming on. We're going about 1 millimeter a second. This is a bare fiber. It's a little more powerful than a jacketed one. Still 1470.
Doing okay, David?
Mm-hmm. Doing great.
So this is like watching balled up newspaper if you don't know what you're looking at, but
That's amazing.
Anyway, we have a discharge sheet with everything you need to know on it, but the top 3 things I would say are doctor's orders. Go to the mall or wherever you like to walk around. No one's ever been laid up after this. Some light activity is good. The compression hose are important so the vein heals shut and for comfort. And then ibuprofen, Motrin, Advil. I recommend 400 milligrams twice a day for 5 days. And that's going to hold you. Because it's not just for pain, it's inflammation. So I would take it whether you think you need it or not. Because once pain starts, it's harder to control. And it's also for the inflammation, so. And then, yeah, we'll have to look at his ultrasound to determine the SSV treatment. So the crook here of the leg tends to be a stubborn area, and also tender because our nerves are right under the dermis of the skin, and the veins get close to the skin here. And so you might feel a little something at the bend in the knee during the follow-up. Most people do fine in that regimen. At about a week or 10 days, you can get new or a little bump up in discomfort because the vein starts to heal and it shortens, and so you can feel like a puppet with a string in your leg. And I just tell you that so it doesn't alarm you when that happens, especially this is a long burn, a long leg, so you're going to feel a tugging sensation in about a week, and you just work through it. It's I just tell people so it doesn't. They're doing great, and then in a week they start to have a little knee discomfort, and it can spook them sometimes. So we'll be done here in just a moment. All right, that's it.
All righty.